Let's bring in Dr. Bayo Curry-Winchell now. She is the Regional Clinical Director of Carbon Health and St. Mary's Hospital in Nevada. Dr. Winchell, I want to start by talking about these N95 masks, this program that's now underway. What are some of the key things to keep in mind when folks are getting these masks and trying to use them and use them correctly?
Thank you for having me. It's really important if you have an N95 that you wear it appropriately. So you want to have a tight seal, and that's really important because that allows for an added layer of protection throughout. And you also want to make sure that you have your straps not crossing over. And so those are two key elements to really wear your N95 in the best way.
I want to ask you too about this subvariant of Omicron that we've been talking about. What makes this thing so different from the original Omicron strain? And what are you telling your patients about how they need to be thinking about it, whether they should be concerned about it?
So there are a couple of pieces that are different. We know right now that there seems to be an increased risk of transmissibility. And so that part is different versus our B1 variant, as well as some studies have shown that if you have contracted Omicron before, you might have a high risk of reinfection, as well as there's an issue with really being able to identify it. However, these are all preliminary data. And so it's important that we just closely monitor and make sure that we just kind of keep an eye on how this variant goes.
All right, Dr. Bayo Curry-Winchell, we appreciate your time today. Thank you.
Thank you for having me.